I'm going to do this one as a bit of a double header. I'm going to start off, but my presentation is about working with people in local networks, and we're lucky to have Joanne Lee, who helped us out with the research in Sefton, who's going to finish off at the end of the project saying more about the kind of support and help that she could provide to research. So I'll do the first bit there and then I'll pass on to Joanne. So I feel a bit of a fraud giving this presentation. There's a whole list of names there, and these are people who did really hard work in the project, including things like developing research questionnaires, focus groups, things like that. All I really did was buy incentives such as gift vouchers for the participants, or go around Costco trying to work out what's the best kind of food to lay on for the people participating in focus groups. So you can imagine me as a man in the office trying to think, what do young people eat? What is healthy? Should I be buying water? Should I be buying Coke? Stuff like that. So that's all I really did. There's a lot of other people that did actually carry out the work. So I'm from the Centre for Public Health. We're commissioned to carry out a service user consultation by Sefton Council. We've got quite a long and established research relationship with Sefton, and really when they need anything done in the field of alcohol or drugs, they tend to approach us. At the same time, there's a review of substance abuse services, so we were only really looking at the service user experience, so it was a consultation, not an evaluation of the services. In England, drug and alcohol services are classed into different tiers, with Tier 3 and Tier 4 being the ones that we were looking at. So Tier 3 are the kind of structured care plan treatment. So it's not the kind of like drop-in places, it's the more kind of drug or alcohol treatment services where you would have a caseworker and you build up a relationship with them. Tier 4 being the more kind of extreme end of this, where it's like inpatient services or residential rehabilitation. So we're looking at those adult services, but we're also getting the views of the users of the young person service in Sefton. And there's a specific service being set up for drug and alcohol use in that area for young people. So we asked the views of the young people who were attending that service, but we also tried to seek the views of young people who didn't use that service. Sefton, many of you will know this, it's north of Liverpool, it's quite a diverse area. You know, to someone coming to this area from afresh, Bootle just seems like a part of Liverpool. So in the south of Sefton, you've got Bootle. In the north, it stretches out to Southport. So there's like various different needs in the different localities within Sefton Borough Council. In the middle, you've got the quite affluent area of Formby. And I do have to kind of point out that the drug and alcohol services that we work with, they're either based in the north in Southport or in Bootle, and don't really seem to form a need to cover anything in the middle. And although many of the services that we're evaluating were Sefton services, some other services are Merseyside-wide, so based in Liverpool. So what we did, we helped support the local networks in carrying out focus groups, interviews and surveys. The only bit of the research we did ourselves was the Tier 4 interviews, the face-to-face interviews with people in residential rehab. And of course we've got the relevant ethical approval for that. So most of the time we were supporting people within Sefton to do the work, to do the focus groups and surveys themselves. So for the adults, we engaged with the Drug and Alcohol Service User Forum, and for the young people service, we engaged with a group called the Sefton Young Advisors, which Joanne is representing today. She'll say more about later on. For the adults, we had 6 focus groups and 162 surveys. I'm going to list some of the kind of outcomes of this, or the findings. Service users were very positive about the services, particularly the impact these services had on their recovery from drug or alcohol use. They feel they might have benefited from clear communication between the staff and service users. They wanted to become more involved in development of local services, and they're also keen to develop and use peer support or peer-led services. All this was happening at a time where Sefton Council had reconfigured their alcohol and drug service, taking from 1 or 2 service providers and then giving it to a new service provider. So that topic came up quite a lot in the research. So, you know, I'm going to give some positive quotes about it on this slide. So one person said that the switch from the 2 different service providers was pretty seamless. Prescriptions were at the chemist and still got the old key worker. So another person suggested it was slightly hectic, But this was an alcohol user who, seen that going from a specific alcohol service into a kind of drug and alcohol service, perhaps actually improved the service, saying there that it's actually been dragged up to the standard of drug services, perhaps highlighting that the alcohol services have perhaps been seen as a poor relation. Some people were a bit more negative, quite strongly negative. One person complaining about how the management handled it all wrong, saying it was done incompetently and it was a bit of a disgrace. Another person going on to say that people could have relapsed and died during the time that services had been switched over, staff didn't know, and even though they're now trying to bring all the services together under one roof, one person's commented that that hasn't really worked. There's been no communication, there seems to be no trust. So negative and positive comments about the services. With the young people, now Joanne's going to probably say a bit more about this, we did 5 focus groups of about 30 participants. These young people were in general very happy with the service. They commented on how good it was to have the individual support. And things like being transported into the service, being picked up, being accompanied to the meetings and being accompanied to other meetings were a very useful thing about the service. Many of them weren't really aware of the service before they started using it or being referred into it. And although they didn't mention that there's any kind of barriers to accessing the service, they did talk about issues of stigma. Joanna and her colleagues would have asked the question, like, where they felt they would be if they hadn't accessed the service. And I'll just leave you to read the kind of comments that some of them came up with that. And I'll just finish off before handing on to Joanne by saying a little bit about the Adult Service User Forum. Being set up by 2005. It's all facilitated by a wonderful person, Joanne Christensen, who is a user and carer involvement. Unfortunately, with age of austerity and all the cuts, that post isn't in situation anymore, and she's moved on to something else. But it really puts service users at the centre of local decision making, which in turn is seen as great as enhancing their confidence and self-esteem. They have actually been really keen to support not just that evaluation, but other research that they've done. So for example, they really carried out a service user consultation. They also helped do pilot interviews for another project, and that actually is a project that Sue has just mentioned, the Radar project, where in setting up the telephone interviews, we got the Sefton drug users to pretend to be Manchester alcohol users to let Sue test out the questions we would be asking in that survey. And another thing that they've done, which was really great, they've helped kind of support my PhD student in trying to work out her plans for her PhD, which is involved with drug use, alcohol, hepatitis C. So I'll now get Joanne slide up and invite her to say some about the more interesting stuff about this, which is the work that her and her colleagues do.
I'm Joanne Lee, and I'm from the Sefton Young Advisors. Has anybody ever heard of this Young Advisors at all? No. We're a national movement, but obviously I work for the Sefton team. We've got about 1,500 young advisors across the country, and within Sefton we've got 12 now. We're just recruiting, so we're going to have about 20. What we are is we're young social action consultants, and we're trained, and we are paid, and we're professionals basically. And what we try to do is we try and engage adults in participating effectively with young people to make sure that the young people can have a decision on the things that affect their lives in the areas that they learn, play and work. We effectively are the middleman, so we're not a youth voice forum, we don't speak on behalf of young people, but we are a sort of the megaphone in the middle. So we consult with young people, we work with young people and sort of reflect their views and opinions up to the top and the key decision makers within the community. We offer a massive range of stuff and we all different services that we can do for all different types of commissioners. We are core funded by our local authority, Sefton Council, but we've recently been able to have more commissions from the private sector and the voluntary sector as well. We offer consultations just like this one, where we're given a sort of research project or something like that, where we go out and we seek their views and we write a quite comprehensive report really and send that back. And sometimes it leads into more work. Some of the consultations we've done in the past around sexual health, and we've worked with young people to say the services you're getting within your area are good enough. With the report that we give that back, it then turns into training for frontline staff, so a consultation can turn into further work. Again, we do training. We've got about 4 or 5 packages that are set up and ready to go. So we offer one around iHeart meetings, it's called, so it's got setting up meetings and stuff like that. But that one also about recruitment and selection, and we can tailor make them for people. We do a mystery shopping service, and research is something, probably one of the biggest things that we do within our team. All of us sit on decision-making boards, some of them including the corporate parenting boards, which is around looked after children, and others, like the LSCB. Some of the pieces of work we've done, I thought might be good to outline some of the history of what work we're doing, and this is just a really small snapshot. This is really the tip of the iceberg. We do a lot more than I can explain in this short amount of time, really. The stroke awareness work is one of the biggest pieces of work that we've ever done. We were approached by the Stroke Association, who asked us to find out what young people knew about strokes and what more they needed to know. We ended up making a pocket-sized sort of leaflet that sort of outlined the steps of how to notice the signs of a stroke and what to do if you notice them signs. We won a national award for that last year because somebody ended up using our pocket-sized leaflet and saved a family member's life. So we won an award for that last year. Some of the other pieces of work that we particularly do around health that might have interest some of you is around mental health, mystery shopping, sexual health, and a rising sort of priority right across the country at the moment of child sexual exploitation, and around about raising awareness of that for young people and sort of in our communities. Just a bit about what we were asked to do on this particular piece of work. We were asked to collect young people's views of the local services that were on offer. In Sefton, there's only really one that is for Sefton only, because, as Gordon was saying, a lot of them are Liverpool-wide. We were asking whether they're getting the right support at the right time. Is it intervention or is it prevention work that they're getting? And was it delivered in the right way, in the way that they thought it was going to be most effective for their recovery or for their support? We asked them if there's anything they wanted to change about it in the future, because we know there was a restructure going on at that moment. And we asked them again, what was the impact of that service and what do they think the impact on other people was going to be as well? Because we didn't just ask them how it affected them. A lot of them spoke quite, passionately about their families and how it's affected their mums and their dads and their nans and their granddads that are looking after them. We chose to do it with an interactive consultation. Has anybody ever used Turning Point before? No, if you ever be on Who Wants to Be a Millionaire, you can ask the audience, they've all got them little pads. We decided to use it like that, but because of numbers, we couldn't get enough young people at the group, so we did it in a sort of open discussion, and we just recorded the discussion that they were having with each other, and it was quite nice to see them in the groups of their peers talking about the issues that they all shared. We did the 5 groups. One was with young offenders, one was with looked after children, with all girls, with a generic group, and we did a non-service users group, where we went to a school with young people who weren't interacting with that judge and alcohol service at that time, and asked them what they knew about the service and what it can offer. We also, gathered the views of them and asked them what more they needed to know. So not just what they already knew, but what more they needed to learn. Just a bit about some of the barriers we faced. Although we're a superbly elite team, we do, sometimes hit a brick wall. So we're just talking about some of the stuff that we faced. And it was mostly about numbers and trying to get people involved. Because although there was vouchers on offer, people were saying, what is there for me to come and, what benefit have I got of turning up? It didn't cause much of an issue, it just meant that sometimes we had a little less time than we needed to go through everything. That was quite quick because we had only a little bit of time. But is there any questions about what young advisors do at all?
Just curious if there's groups like you outside of Sefton. Do you liaise with, the Wirral or Liverpool? Or...
Young advisors are a national movement. Notably, I know about a group of young advisors. Liverpool used to have a team, but it sort of folded, and they weren't particularly strong. The Wirral, I don't know whether they've got one. I know up in Holden they have, so it's quite mixed really. If you just Google, young advisors, it'll give you a map sort of where all the young advisors are based. But we do work quite closely with our sort of Merseyside neighbours.
It's very impressive that it's been set up so successful as well.
It is. It was quite quick. I don't know if it was like a whistle stop at all, but there's a lot of work that we can do that people sometimes forget about us because we're just in Sefton and we're not sort of Merseyside or anything like that. But it's a really, really good thing to work with.
Can I ask if you've done anything with other universities?
Yeah, we lecture quite regularly at Edgehill University with youth work and social work students, talking about how to effectively communicate with young people, and we also train designated teachers that are going, I can't remember what university we do that at. So we do quite a bit of work with Edgehill, and obviously John knows that.
questions.
Can I ask what kind of background or attributes are they looking for people like you to do this work?
So if
you were to apply for the job, what are the people that employ you looking for in terms of your attributes?
anything basically. So we're 15 to 21. We have to retire on our 22nd birthday, unfortunately, without a pension plan. There's no pension plan set up. But we're a completely diverse group of people. So we've all come from different backgrounds. So we've got care leavers, we've got people from ethnic minorities, we've got disabled young people, and all we really want them to do is be passionate about the work that they do and to make a difference, really, and to want to make young people's voices heard, because sometimes we forget about their voice a little bit, don't we? But that's it, really. Anything, you can have orange hair and 11 fingers or something like that, but it doesn't really matter. So I'm just passionate about the work that you do.